Hello everyone, a very good afternoon. Hello India, in fact, I'm Dr. Beena Kukkala from Hyderabad, Telangana. I'm a consultant cardiologist from K Hospital, the most renowned hospital in India. Now I'm going to give a talk on a topic. As usual, everyone is pretty much aware of that. Coronary artery disease, nothing but in a lay person language is called as heart attack. I just wanted to give a clear-cut description and a brief description, like what is heart attack and what is the etiology, what is the cause of it, what's the treatment part of it, and how to avoid it. So, as everyone knew that prevention is better than cure, I'll specifically talk on the heart attack problems in women. So, my topic for today was heart attack, coronary artery disease in women. So, coming to the point, women is also under pretty much stress as equal to men nowadays. People are also working around, taking care of the family, running around. So, the first and foremost thing is about your age. There are so many risk factors which are modifiable and which are non-modifiable. So modifiable risk factors are nothing but the smoking, drinking, and all, and taking alcohol consumption, smoking, and your other extracurricular activities going on. But whereas most of these women in India are basically non-smokers and not an alcoholics. I'm not talking about the westernized culture people. So the other thing is these are modifiable risk factors where you have to avoid your smoking, and consuming alcohol is not advisable. But taking one pack daily red wine, that is for the males who are above 70. And the other one is these are modifiable risk factors, whereas non-modifiable risk factors are coming to age, your gender. So male and female, your age, once you're 40 plus, nowadays age has no factor at all, because I've even seen people who are getting 25, 30s, running in the 20s and 30s having their heart attack. The other one is age, comes then gender, and the other modifiable risk factors comes your hypertension, your diabetes, your underlying other risk factors. For example, you have previously any structural heart diseases or any functional heart diseases or any recent workload because of stress, everything and all. No person on this earth can avoid stress, as a matter of fact. The only thing is you have a type A and type B personality. Type A personality always takes everything into himself. That is called as he gets apprehensive for each and everything. So that is type A. These people fall under stress and they increase their hypertension. They even fall very sick and they can't recover. And type B personality are chill going types, just easy going types. So I suggest all people to be as type B types. I know it's very hard to practice, but try to do this. Coming to the point, what is heart attack? Heart attack is nothing but a block in your coronary arteries. If the blockage is more than 70%, then a person will get a heart attack. For most of the people, you have symptoms and most of them are asymptomatic. 80% of the people fall at the doorstep of doctors. Death itself is recorded in 80% of people. So to avoid this, nowadays we have so many investigations to land on the judgment whether your person is prone for getting heart attack or not. So your blockage is, if it is more than 70% in your coronary arteries, the person is prone to get a heart attack. Another thing is, Indian community, most of the villages, if there's 80 to 90% also people are able to take it. The only reason behind is the workload. The very first thing is, first, women are more prone to stress. I advise these people. So before getting into heart attack, once you're 40 plus or 45 plus, if you have no family history background, then you can continue your investigations at the age of 44, 45. When you have a strong family history of coronary artery disease, for example, your siblings or your parents running in the family, or maternal uncles, paternal uncles and aunts, anyone in the family has a heart attack, so better go for investigations at the earliest. The investigations are let you, the basic investigations are nothing but electrocardiogram and 2D echo and treadmill test. These three will give a quite clear picture of what's going on inside the heart. And there are many cases wherein these three are normal, but person will have an heart attack. So the rule out that we have the best other investigation by name CT coronary angiogram. This is first and final to rule out it. And if the person is prone to heart attack, you can also go for direct invasive angiogram. So what is the reason behind getting a heart attack? The one is modifiable and non-modifiable risk factors. The other one is your food culture, your stress culture. So as much as thing, you have to go for a green, healthy food, nutritious food, like fiber-rich food, avoiding all the junk food and deep fried foods, sweets and all, and putting your hypertension and diabetes under control. If you have a hypertensive, don't be reluctant and hesitant to go to a doctor. Visit a doctor regularly. Cut down your salt consumption. Go for salt-restricted diet modifications, and go for regular exercise. If not anything, at least half-hour walk in your whole day of 24-hour schedule. So I repeat. So first of all, what is a heart attack? Is a block in the coronary arteries. If you want to avoid it, there are the modifiable and non-modifiable risk factors. Modifiable, you can do it, control your hypertension, diabetes, and non-modifiable, you can't do anything for that. The second comes your age, Once a person is getting older and older, he is more prone for getting heart attacks. But your type A and type B personality, I suggest to go for type B personality. Be a chill going, easy going type of chap. Nothing can do. One day we have to leave this earth at any cost. The other one is the hypertension, and hypertension, don't be reluctant, and diabetes is the most chronic and critical risk factor running in Indian family. Almost India is becoming a second capital all over the globe for diabetes. So for diabetes, you have to follow some health, many precautions. There's so many things, ingredients in your kitchen itself who can help you. First you accept that you are diabetic, provided if you are really diabetic. If you're prone to diabetic, also get your investigations done regularly. Your fasting sugars, post-lunch sugars, your HbA1c levels, and your fasting lipid profile as well. Your fasting and post-lunch sugars are on the higher side. Cut down your sugar levels, and try to do some small kind of exercises, aerobic and anaerobic, whatever, weekly once, at least 2 to 3 hours per week. And next comes the women. Women usually in the reproductive age, 15 to 45 years, they are not prone for heart diseases. As such, the hormones are productive, estrogen, progesterone, and all. Once a woman attains a menopause age, she carries the risk as equal to as men. And the other thing is, though a woman is less than 45 years of age, if she has a family history strongly positive for CAD, she may prone for heart attack at any given point of time, provided she is under stress control. And getting a kids at an early age before 30 is advisable. If she's more than 30, just take care. The other thing is gestational hypertension, gestational diabetes, polycystic ovarian syndrome. These are other major factors when women are prone to getting heart attack. Gestational hypertension is nothing but if a person gets a hypertension when she's pregnant, that is called as gestational hypertension. And she has to be monitored continuously after 6 months of postpartum. Later, after once in a year, she should get a regular checkup and go for a salt-restricted diet and go for healthy exercises and eat a good food so that you won't have an hypertension in the near long future. The other one is gestational diabetes. It's also same as gestational hypertension. Cut down your sugar levels, go for a healthy food diet, and the other thing is obesity. You have to control your obesity at any cost. Your BMI should not exceed as per the given records. The other one comes your polycystic ovarian syndrome. Your health is try to visit a gynecologist and get your levels done periodically, checkups done, and go for the further medications. The last and the least is not but your age. You can't do anything about your age, but be very careful. And the other thing is what the treatment part of heart attack. The treatment part of heart attack comes into play when a person realizes and he accepts that he has prone to heart attack or he is about to get a heart attack. So once the investigations are normal, don't worry. But once you cross your age of 40, be very careful. Check your cholesterol levels very now and then, often at least once in 3 to 6 months in a year. Later comes to visit your doctor regularly. Once you visit your doctor, if the person has a heart attack, don't get hesitated. Just go visit him comfortably and get your investigations done. Suppose if a doctor says go for an angiogram, go for an invasive angiogram. No issues in that. It's hardly a 10 minutes investigation. After angiogram, if the person says you have to go for an angioplasty, there's nothing but putting a stent and removing the block. You're prone for that, go ahead with that. Nothing to worry about it. And if the person has multiple blocks and the doctor says that you have to go for a bypass, that also just go ahead. Just go ahead, nothing to worry about. Nowadays, you have got many special equipments and technologies wherein even the bypass surgeries are pretty clear at hand and it's at an affordable cost, so nothing to worry about. So this is a clear-cut picture. What is heart attack? A blockage in arteries, and how to get a heart attack? That's because of risk factors, and how to avoid a heart attack is in your hands. And once you get a heart attack, what is this? Doctor is the only final solution for that. A cardiologist, visit a nearby cardiologist, a DM intervention cardiologist, get an angio done, and see to it if the blockage is more than 70. If it is less than 70, we go for medical management. We put you on ecosprin, any antiplatelet drug like clopidogrel. The other comes your statin. Statin plays a very vital role in this controlling the cholesterol levels so that your atherosclerosis plaque does not harm in further future. Then comes your other related drugs which are mostly controlling your hypertension and diabetes as such. And don't worry, there are multi-billion drugs which are also protecting you from hypertension and diabetes nowadays. There are very many research roles coming into play. So use your medication regularly, get a proper food, don't get worried. Whole globe is under global pandemic of stress. Come out of it. Thank you so much for your patience. Thanks once again.